This Docs on Call is brought to you by Excellus Blue Cross Blue Shield and UHS. I'm here with Dr. Michael Lissy with UHS Orthopedics in Binghamton to talk about meniscal transplant surgery. What is the meniscus?
So the meniscus is a sort of a cushiony, spongy tissue between the two bones that make up your knee.
That's simple. So who's eligible for a transplant?
So a transplant's a pretty tricky operation, and it's got a fairly finite population that is acceptable for it. On one hand, you need somebody who doesn't have a meniscus anymore because they need a new one. But on the other hand, they can't have any arthritis in their knee joint or damage to the cartilage, which is the tissue underneath the meniscus. And so it's a timing kind of a thing. And you want to avoid somebody who's too old, so it's a younger population. And you want to make sure that there isn't any other problems in the knee, so that there's no ligaments damaged and there's no alignment issues. And if you meet all of those criteria, then you should get a meniscal transplant.
It sounds simple, but how's the surgery performed?
It's not simple. It's sort of a big deal. What happens is we get a donor meniscus. And so once you have a donor meniscus that's appropriately sized for the patient, you have to go in and you take out whatever remnant of the meniscus is there. And then depending on which side you are, you use different techniques to fix the meniscus inside the knee. But it's predominantly arthroscopic surgery. You're using just two small holes, which then you widen up one to get the meniscus transplant. And then you fix it using either a screw with some suture to tie over it and fix it down in place.
What about recovery?
So recovery can be somewhat protracted. It's just like if you had a huge meniscal tear, we have to give it a chance to heal back down. So oftentimes you're in a brace for a good 6 weeks or so, and we don't let you bend your knee too much, and we might limit how much you're able to put your weight through that.
All right. Thank you, Dr. Michael Lissy with UHS Orthopedics. If you want more information, go to our website, WBNG.com. If you want to leave a comment or ask a question, call 584-7362, 584-7-DOC.